Congratulations on your new baby. This video, brought to you by the EvergreenHealth Lactation Consultants, is designed to answer questions you may have about the crying baby. Babies are born with about 25% of their brain development, so your baby doesn't have a lot of good communication skills yet. But one thing parents notice is when their babies cry. There are times when your baby cries for a specific reason, and in time you will be able to read your baby's cues. However, sometimes your baby cries and you never can really figure out why. In the early months, the baby is developing a sense of trust in the world and depends on someone to respond when they are in distress, but that doesn't always mean you will be able to fix the situation. As your baby gets older, you will be able to read their calls for help more clearly. It is always safe to start by checking baby's diaper or offering a feeding. Crying babies can't latch well because their tongue is elevated, but bringing the baby close to the breast to smell the milk can often calm them enough to latch. Many babies have a few nights of cluster feeding where they don't seem to want to leave the breast at all. This is common on night 2 and 3 and can occur in the 3rd week and 6th week of life. During this time, your baby is attempting to adjust your milk supply. Allowing your baby unlimited time at the breast will assure ample milk supply in the future. Parents develop all kinds of skills to comfort their baby. It's safe to say that in the early days, the baby would like to just go back in the womb, so it seems any comfort technique that mimics the baby's pre-birth world may be calming. So starting with a dark room, holding your baby closely and near your heartbeat, and some walking or swaying can feel familiar to the baby. Swaddling your baby reminds them of the close embrace they had inside and can often calm even the fussiest baby. Dr. Harvey Karp has developed some comforting techniques known as the 5 S's, which include sucking, swaddling, side position, swooshing sounds, and swaying. Remember, crying is a normal part of every infant's development. Parents are often concerned crying is related to an illness or condition that is abnormal. Between 2 weeks and 3 months of age, some babies cry a lot, and this is known as the period of purple crying. Purple doesn't mean your baby turns purple, but actually is an acronym for peak of crying, unexpected crying, resisting soothing, pain-like face, long-lasting, and more in the evening. During these periods, nothing seems to help, even techniques that worked before. If you are feeling stressed or at your wit's end, it is always okay to place your crying baby in a safe place on their back, such as their crib, and take a moment for yourself. For more information, visit purplecrying.info. We also recommend the Evergreen Parent-Baby Groups to all new parents. The common topics at these facilitator-led groups are sleep, infant feeding, and calming a fussy baby. Call the Evergreen Health line for more information on these support groups.